Hello, my name is Dr. Phil Brotman, and today I want to speak to you about preventative medicine. Quality of life will be greatly improved if we can prevent disease instead of waiting for disease to help. There's a focus in medicine from switching for doctors being traditionally just treating people after the fact to being proactive. And we should generally screen for diseases where we have some treatment to offer the patient. Okay? But look, the number one cause of death in the United States is heart disease. So we better do some tests to screen for heart disease. All right? Stroke and heart disease both are atherosclerotic causes. So if we reduce diabetes and hypertension and obesity, with our patients in order to promote a healthy lifestyle and a long and happy, productive life? Well, the first most important thing is smoking, which we'll cover separately. This is the single most important thing you can do to prolong your health, is to stop smoking. All right? Now, the second thing, which we'll cover now, is sun safety. Certainly skin cancer and melanoma are more common with exposure to the sun. So it is appropriate for the physician to counsel the patient to use hats with large brims and the liberal use of sunscreen, as well as when doing a physical exam on a patient to expose the entire surface of the skin and look for suspicious lesions. We're going to talk about weight today. risky behavior, such as unprotected sex, that can lead to HIV and hepatitis B. Okay? We need to query them about their hobbies and their work life to understand if they're at risk for any asbestos or any danger from the workplace. Okay? The breast exam should be learned by all patients, and every woman over the age of 40 should have yearly breast exams by their physician, as well as mammography done to look for the early detection of breast cancer. Okay? Certainly there's other modalities now to look at the breasts, including MRI, but mammography remains the standard. Okay, every year. Men should be taught as teenagers how to do a self-testicle exam, as testicular CA is common even in young men. A skin screening should be done annually to look for suspicious lesions, right? And this is a good time to emphasize the use of sunscreens with the patients. Okay? For cervical cancer, Pap smears should be done, right? When to start Pap smears? Pap smears should start at age 21, or if the patient is sexually active before the age of 18, should be started 3 years after the beginning of sexual activity. All right? All right? All right, that should be done every year. Slightly older women, 30 and up, every 2 or 3 years is the recommendation. All right? And now, for cancer, we also have a vaccine for the human papillomavirus, right? And that can be given from age 9, recommended up to age 26, and it's most efficacious if given before the woman becomes sexually active. This vaccine is active against 4 strains of the human papillomavirus, so even if the woman is sexually active already, it's still worthwhile giving. Okay? All right. For endometrial CA, certainly the history is somewhat important, and you're going to ask patients about postmenopausal bleeding as well. What about colon cancer? Completely preventable almost all the time. The natural history of this is that the patient has a polyp, which is non-cancerous, and then it undergoes malignant degeneration and becomes adeno-CA or colon cancer. So if we could find those polyps before they turn into cancer and remove them, we've potentially saved a life, right? And certainly prevented a lot of suffering. So how do you screen for colon cancer? Certainly by age 50, everybody should be having yearly fecal occult blood testing, right? Even better is fecal occult blood testing and flexible sigmoidoscopy, right? Right? Even better than that is colonoscopy, where the entire colon is visualized by the gastroenterologist, and any suspicious lesions can be noted, and through the colonoscope, any polyps, well, many polyps can be removed at the time of colonoscopy, and no further surgery is needed because it's removed through the colonoscopy. Okay? You could still do barium enema of air contrast, but that is falling out of favor. The colonoscopy, you can see the problem, directly visualize the problem, and treat the problem all at once. All right? Which one indicated up to age 26, so she would not be a candidate for the vaccine under the current indications. Okay? And the cancer screening case will be something like that. They're going to give you a case, and they're going to say, what tests do you need? Thank you for listening to me. That's the end of the cancer screening section.